Yes, here is your stem.
Yes, ma'am.
Okay, so if you've read and understood, considering it history taking station, please begin.
Hello.
Hi,
My name is Dr. Naveed. I'm one of the surgical candidate today. Can I please confirm your name and age?
my name is John. I'm 54 years old.
Good.
All right, John. I have been asked to ask you a few questions today. Would that be okay for you?
Okay, no problem.
John, let me know what brought you today.
Um, I have a problem with uh,
Swallowing.
with the swallowing.
All right. Can you please tell me a little more? When did it start?
It start 10 months ago, and it's became worse every time. It start with solids, and right now even liquids.
All right. Did it start suddenly or gradually?
I told you already. It start gradually.
All right. And anything made it worse?
No,
Anything that makes it better?
no.
Uh, did you do anything for that?
Um, it sometimes became good, and but sometimes became I can't swallow even my saliva.
All right. Uh, is there anything related to this, like any fever or vomiting?
No, no,
Any any pain in your throat?
no,
Do you feel that the food is getting stuck into your throat?
no, no,
Is there any swelling in your neck,
no. There is no swelling.
in your throat?
No,
Did recently felt any bad smell in your breath?
no, no,
Any pain while eating or
N-
swallowing?
no,
Right. Uh, did you feel any heartburn?
no, no, no heartburn.
Right. And did you feel that recently you are losing weight?
Yes, I have noticed in the last 2 months that I've been starting losing weight.
Any lumps or bumps in your body?
No,
Any night sweating?
no, no.
All right. And uh, do you feel any? Do you feel that in the morning any food particles on your pillow?
No, no, no food particles.
Well, okay. Do you have any medical condition?
No,
Any surgical? Any history of any surgeries?
no,
Taking any medications?
no, no,
Any family history of any disease or any cancer by any chance?
no.
Do you smoke or take alcohol?
Yes, I smoke and I drink alcohol.
How much do you smoke?
2 packs a day.
And how much do you drink?
Like 10 units per week.
Did you ever try to quit on smoking,
No, really, not really.
cutting down onto alcohol.
No, no.
What do you do for living?
I'm a teacher.
Who do you live with?
I live with my daughter.
All right. And do you feel any, do you struggle to use stairs?
No, no.
What do you think? What could be the reason for your condition?
Um, I think it's cancer.
Why do you think so?
Because I have my friend. He had the same symptoms, and later on they diagnosed him as cancer. So this is my main concern.
I'm sorry to know about that.
Yes.
Uh, what are you expecting today from us?
Um, to treat my difficulty in swallowing and to know the diagnosis.
All right. A few more questions. Do you have any chest pain or cough?
No, no, I'm all right.
Difficulty with breathing?
No, no,
Any joint pain or swelling?
no,
Any problem with your poo?
no,
Any difficulty with urination?
no.
Well, thank you so much for answering all my questions.
Okay, thank you.
Can you please summarize your history now?
Today, I took history from Mr. John, a 54 years old man who brought with the complaint of dysphagia. It developed gradually 10 months ago. In addition to that, it did not relieve with anything, or nothing could worsen the condition. Moreover, uh, he was losing weight gradually, which he noticed, and there were no lumps or bumps in his body, no night sweating, no food particles sticking into his mouth, no bad breath in the breath. There was no.
So what is your provisional and differential diagnosis for this patient?
My provincial diagnosis is carcinoma esophagus because of losing weight and being chronic smoker and alcohol drinker.
And what are your other differential diagnoses that you'll consider?
My other differentials are pharyngeal pouch, achalasia, cardia, GERD.
Okay. How would you confirm your diagnosis? What investigations would you ask for?
As I'm suspecting cancer esophagus, I would like to initially order endoscopy with biopsy and barium swallow, esophageal manometry
Okay.
to rule out GERD or esophagitis.
Yes.
And for blood investigations, I would like to do full blood count, U&Es, coagulation profile, LFTs, and I would also perform urine complete examination.
Okay.
Moreover,
What treatment can you offer this lady or this man?
if the cancer is diagnosed, I would like to. There are there are surgical options and non-surgical options. The surgical options are resection of the esophagus and anastomosis, and uh, along with chemoradiotherapy. The non-surgical options are palliation, self-expanded esophageal stent, and feeding jejunostomy, chemo, and radiotherapy.
Okay. Thank you.
Thank you so much.